Navigating healthcare in Spain can be really confusing. When you first move, you don't know where to start. What's free, what's private, or what paperwork you actually need. So here's what we learned from doing it ourselves with kids. When we arrived, we didn't have our SIP cards, which is what you need to access the public healthcare system. And honestly, that whole process isn't something anyone really explains properly. We've done the paperwork for residency, but no one told us how to actually register with a doctor. So at first we went private, and it was surprisingly easy. We booked online, we got seen quickly, and the prices weren't ridiculous. We paid out of pocket for a few months whilst we figured out the rest. For peace of mind, especially with the kids, it was 100% worth it. Then once we had all of our paperwork sorted and got into the public system, things started to click. We've now got a family doctor, we've used paediatrics, emergency care, and it's been solid. Slower sometimes, but thorough. And honestly, the doctors here actually listen to you. They're not trying to rush you out the door in 7 minutes flat like we're used to in the UK. So here's my advice. If you're moving here, expect it to be a bit confusing at first, but don't panic. Go private to start if you can. Sort your paperwork bit by bit, and don't be afraid to ask questions. Even if your Spanish isn't perfect, people are usually willing to help. So save this if healthcare is on your moving to Spain list. And if you want the full step-by-step breakdown, I've got a written guide that explains the whole process, including how to get your SIP card, register, and what to expect. You can find it in the link in my bio. Follow for more honest content on moving to Spain, and not just the sunshine and sangria version.